I'm Cassidy.
I'm Dr. Alyssa Dweck.
If you were to have your perfect sleep hygiene routine, what would that look like? At what point do you think women should really kind of get serious about
ASAP.
Hi there, I'm Cassidy with Bonafide Health, and we are here today with Dr. Alyssa Dweck, and we're going to talk about menopause and sleep.
Hi, Cassidy. Thank you. This is such a hot topic. So for those of you who don't know me, I'm Dr. Alyssa Dweck. I am a practicing gynecologist here in New York City, and I am the Chief Medical Officer at Bonafide.
Okay, so let's just jump right in really quickly. And we hear this term tossed around all the time about whether it's menopause or not. Everybody's talking about sleep hygiene. So just to establish, our definition here, can you just go into what that means a little bit?
Yeah, because it does kind of have a weird ring to it to say the word hygiene when we talk about sleep. But basically, sleep hygiene just refers to a collection of behaviors that can be helpful to optimize sleep. And we're talking about sleep duration, we're talking about sleep quality, and behaviors that can enhance that.
So if you were to have your perfect sleep hygiene routine, what would that look like?
Well, I think the key word there is routine. Okay, so it is extremely important to keep a routine with sleep. I mean, obviously things like vacation or some special event at night are going to interrupt typical sleep hygiene routines. But in general, having a general routine can be very, very helpful to optimize sleep. So by this, I mean going to bed at about the same time each night and planning to wake up at about the same time each morning. And that's very, very important. Of course, shift workers may have a very different situation, and we can talk about that totally separately. But in general, a routine is good. We usually talk about the ideal duration of sleep as about 8 hours. So I guess the range 7 to 9 would be optimal. There are a couple of other things that we really have to incorporate in the sleep hygiene collection of behaviors. So we often talk about avoiding screen time before bed. What does screen time mean? Well, TV for sure, but more, of course, is the phone or an iPad or a computer. Not only because the blue light emitted by these devices could interfere with typical brain activity, but also because it gets the mind really revved up, and that might interfere with falling asleep and staying asleep. Other behaviors that are very helpful would be avoiding large meals before going to sleep. We all know that if you lay down after a large meal, you may get some discomfort in the esophageal area as a result of reflux, and that is horribly uncomfortable. So really give some time in between last meal and the amount you're eating and going to sleep. The comfort of the room is so important when it comes to sleep hygiene. So temperature. Believe it or not, cooler temperatures are favored for ideal sleep, even as low as 62 degrees Fahrenheit. And yes, we may be freezing some of our partners out. We've seen lots of spouses, husbands, and male partners going to sleep with hoodies on because women are often having difficulty with temperature at night, and they turn the thermostat way down. You can also consider some relaxing activities before sleep. A warm bath, cup of tea that is decaffeinated, avoidance of caffeine and or alcohol, which are both big sleep disruptors. So these are things to keep in mind.
So no doom scrolling, no midnight snacks. That's kind of
it sounds so unfun, but it does help.
Yeah. And requires a certain level of discipline as well to keep that routine going.
Most definitely. And look, I'm realistic about the advice that I provide for patients for sure, because this can't necessarily happen, in a vacuum. So we do the best that we can to follow sleep hygiene.
So specifically, how does menopause affect these sleep patterns?
Yeah.
Especially as, women maybe, in their 20s, 30s had a certain, sleep chronotype, so to say, they're early risers, night birds, whatever. This can really change dramatically once menopause happens.
Yeah, I mean, if you want to compare what went on or what goes on for women in their 20s and 30s, think about PMS time, premenstrual syndrome, where sleep is often interrupted for various reasons, whether it's menstrual cramps or flow or the mood changes that occur or temperature intolerances that occur that couple of days before one menstruates. And this, of course, is mostly hormonal. In the perimenopausal transition and in menopause, we also see that hormone changes have a huge influence on sleep habits. In many ways, But the most common would be the physical change of vasomotor symptoms, hot flashes and night sweats. And, I get asked all the time, what's the difference? Well, there really is no difference between hot flashes and night sweats, except that the night sweats are hot flashes that occur at night when you're sleeping. But they can be incredibly disruptive because not only do people get this sudden surge of unbearable heat, furnace level heat that occurs suddenly and awakens them from sleep, but then the waterworks start and we have huge amounts of perspiration, and it can make people uncomfortable enough that they have to actually get up, change their bedclothes, maybe even change their sheets. And of course, then there's a lot of difficulty falling back asleep.
Yeah.
The second common complaint that I hear during menopause is that women wake up in the middle of the night for no apparent reason or due to a night flash or a night sweat, and they cannot get back to sleep because they are dealing with almost what we're calling the busy mind. They have so many racing thoughts through their head that it distracts them. They start building a to-do list of what needs to get done during the day, and they cannot get back to sleep. So these are two very common scenarios in the menopause population.
I struggle with that too, and I'm not even in menopause yet.
Well, you're just preparing for the future. Exactly. I also will say that many menopausal women complain of two other kind of unique things. The first is having to get up in the middle of the night to urinate once, twice, or even 3 times, and that is very disruptive, especially to try to get back to sleep. And another thing that occurs commonly in the menopause population are symptoms of restless legs, or periodic limb movements, we call it, where there are some muscle spasms and just general discomfort where muscles are aching and twitching, and this can be quite uncomfortable.
Yeah, I remember when I was younger, my mom used to talk about restless legs a lot. And, are there other, medical conditions that can contribute to restless leg syndrome, or is it, or be exacerbated,
Well, look, electrolyte balance and certain things like magnesium, potassium, these things can certainly influence our muscles. So just making sure that dietary needs are being met. Many women find magnesium to be helpful to prevent some of these muscle cramps, but also to help with sleep. So we are relying on magnesium supplementation, especially if we don't get enough in diet as menopausal women. One other thing that I should bring up would be sleep apnea, because while sleep apnea is not unique to women, it is common in women, particularly the type of sleep apnea that is related to structural changes in the airway. And believe it or not, sleep apnea is actually related to and associated with having to wake up in the middle of the night to go to the bathroom, because it tends to almost exacerbate overactive bladder symptoms, which are very common in the menopause population. By far and away, though, women who wake up in the middle of the night during menopause complain that they can't get back to sleep. It is much rarer to hear about the woman who can't fall asleep, because think about it, so many women at the age of menopause are exhausted by the end of a day. So falling asleep is not necessarily the issue at hand.
And do you find that most women who are complaining about staying asleep tend to wake up around the same time of night, or, these vasomotor symptoms, do they tend to happen around the same time every night?
That's a great question. And the answer is I don't really know whether the hot flashes and night sweats occur at the same time each night, but I do hear that nighttime awakening for no apparent reason is always at 3 a.m. or always at 4 a.m. Of course, those witching hours where it is really rough to get back to sleep and then get a good quantity of sleep after that time.
So if a woman is, struggling with these symptoms, is there a point at which, I feel, as women begin to experience these perimenopause and menopause symptoms, they'll bring it to their healthcare provider. Is there a point where they should be concerned about the severity of their symptoms?
Well, look, I think the biggest reason women come in and talk to their gynecologists about these symptoms is because they are having trouble functioning the next day if their sleep is so interrupted. They complain of brain fog, which is a very common symptom where there's, memory trouble and trouble focusing and trouble with decision making and, all of those symptoms that we, use the term brain fog for. And getting a good night's sleep, of course, in quality and quantity can be directly related to brain fog. So yeah, this is a pretty common symptom.
So for women struggling with these symptoms, what are some treatment options if somebody were to come to your practice, complain of these symptoms? Where would you start with that?
Right. So first and foremost, let's treat hot flashes and night sweats because that is manageable, whether it's with hormone therapy, whether it's with other non-hormonal drugs, whether it's with herbal supplements, whether it's with lifestyle changes or a combination of any and all, that can be extremely helpful to at least get rid of the physical discomforts of these vasomotor symptoms. So if you're not waking up in the middle of the night sweating and having to change clothes or just being uncomfortable, that'll be a very, very big step forward in terms of helping with sleep.
And the freezer's always there if you need it.
Yes, well, that is the old standby, the sticking your head in the freezer treatment option, but I think that doesn't go too far.
Yeah. And, what role do things like, you mentioned lifestyle changes, what roles do things like exercise or things like that have to do with sleep?
Exercise is extremely helpful for so many reasons, but specifically as it relates to sleep, it does help to dissipate stress so that if you're having trouble remaining asleep or getting to sleep because you've got so much on your mind that is stressful, exercise can help to relieve some of that stress and translate into better sleep. In addition, I would say diet has a lot to do with sleep. So we know that caffeine in particular can have long-lasting effects. So eliminating caffeine and its property of keeping you awake or making you a little bit more hyperactive, eliminating caffeine late in the day can be very helpful. Alcohol, one of the biggest misconceptions is that because alcohol can help you fall asleep because it relaxes you, it actually disrupts sleep because of the effects that it has on the brain. So I would say minimizing or, moderating alcohol use before bed is important. Large meals or high sugar loads can absolutely interfere with falling asleep and even staying asleep. So diet has a lot to do with basically everything, but for sure sleep quality.
And for those, I feel experiencing overactive bladder or incontinence, potentially just reducing liquids before you go to bed as well can probably help with those symptoms.
Yeah, this is kind of a double-edged sword because we want people to remain as hydrated as is healthy. Perhaps limiting consumption of water at a particular time before bed could be helpful. Also remember, we do lose some hydration when we're having night sweats, so it's important to maintain a balance. But absolutely, the caffeine, the alcohol, and water intake should be, really watched as it relates to sleep.
I know you mentioned magnesium, as a supplement. Are there, things like melatonin or natural sleep aids that you would, recommend that could be helpful with these?
I do recommend magnesium because, number one, it seems helpful. There's pretty good literature behind this, but also it may even help with some calming of anxiety. But we do find this to be helpful, especially when taken as directed. Again, I usually recommend a form of magnesium other than magnesium citrate, especially if somebody is taking a fair amount, because magnesium citrate can work as a cathartic or make you have to evacuate, if you will. So we don't want that to be something that also interrupts your sleep. So magnesium can be helpful. Melatonin can be helpful for some people and not others. It is particularly helpful with jet lag and in shift workers to help with sleep maintenance. So that would be something to keep in mind. As far as things like antihistamines and whatnot, these can often make people a little bit drowsy, particularly in the morning upon awakening. So they're not necessarily right for everybody, but we do see that this could be helpful. And then some of the prescription medications we're very careful with because they may have an addictive potential. They may also make people too drowsy. They also don't necessarily mix well with other medications. So really we have to approach this type of thing on an individual basis.
Yeah, case by case, for sure.
I will say this, if we really can't help somebody in the sleep realm as gynecologists, we are very quick to refer for a sleep study, particularly to diagnose sleep apnea, because that can often be managed with a mechanical device, and a sleep study would really be the best way to diagnose that.
Is sleep apnea something that can be considered a menopause symptom that can spontaneously come up during menopause, or is it some underlying conditions that might contribute?
I would say yes, because because changes in hormones do change the, fluid retention or fluid status for some women. Also, if there's weight gain during menopause or perimenopause, that can contribute to sleep apnea for some people. Keep in mind, I am not a sleep expert, but from the bit that I know as it pertains to my practice, some people will rely on a machine like a CPAP or a positive pressure ventilation type of machine to keep their airway more open so that sleep apnea is not much of a problem. But sending somebody for a sleep study can be really helpful.
Sure. I want to go back really quickly to what you're saying about shift workers because, I know in our demographic or, women who experience perimenopause and menopause, a lot of them are nurses. A lot of them, work odd hours, which can be an extra kind of uphill battle when you're already dealing with sleep issues. What are, some additional things that maybe you would recommend around their sleep cycle, routine, hygiene?
Well, look, hopefully with most shift workers, and I was one of them for quite some time delivering babies, there's a little catch-up time for additional sleep when your shift is over. Shift workers are one of the rare groups where we actually recommend napping if necessary. Staying on some sort of a sleep routine is incredibly helpful. Really planning meals appropriately around your shift, because think about what a lot of shift workers may do. If they're feeling sleepy during the day, they may start snacking high sugared things. High caffeine in and of itself may alter sleep habits as the day and night goes on. So, something that does come to mind that I think might be important is to think about things that we don't often think about, like what are you wearing to go to sleep? Look at the fabrics. Are they comfortable? Are they moisture wicking? Because if you're somebody having a lot of perspiration due to night sweats, the choice of materials for bedclothes could be game-changing. In addition, mattress choices, sheet choices, and that type of thing could also be very helpful to make sleep more comfortable.
Yeah, and those are just little easy changes that you can make and go a long way with your overall comfort.
Most of the time.
Yeah. So if night sweats or hot flashes during the day are, extremely persistent or seem very severe to the patient themselves, is that something that, at what point you as a healthcare provider would maybe some alarms would go off?
That's such an important thing to talk about because hot flashes during the day are usually just that. They're related to hormone changes. But at night, if somebody is persistently literally soaking the bed, especially if treatment has been undertaken for vasomotor symptoms of menopause and it's just not helpful, there really could be something more concerning going on. For example, infection or even certain malignancies, which can cause, night sweats that are overwhelming. And this is just not one bad night. This is persistent and really notable. So definitely something to bring up to your doctor. It may surprise people, but probably not that much, to know that when you look at the brainwaves of men versus women, they really are different during sleep. And one thing that really comes to mind based on my patients' complaints is that the busy mind or these nighttime awakenings in women seem to be unique to women. There's much more brain activity going on for women during sleep than for men. Go figure.
Yeah. It's almost like women have more to worry about than men.
And that's a good spot to put in that brainwave graph.
Yeah.
A lot of women do have to deal with urinary complaints day and night, one of them being incontinence or leakage of urine involuntarily. There are some women who will take medication to help to control urine leakage when they're not anticipating it. And this could help for those women who are getting up in the middle of the night to urinate all the time. Some women who have a relaxation of their pelvic organs may rely on a little device called a pessary, which holds and supports the pelvic organs and may help to prevent some of this nighttime awakening to urinate. But all in all, those are more peripheral treatment management strategies, and really this has to be taken on a one-to-one basis.
Yes, definitely. And, I guess as, incontinence and, overactive bladder can have a dramatic effect on your quality of sleep. Perhaps if there's a woman who a pessary isn't necessarily required, do things like, pelvic floor exercises, things like that tend to help.
Yeah, pelvic floor exercises, either with a physical therapist who can help with this or with vaginal exercises, to be quite frank, that are over the counter, can be very helpful for overactive or leakage symptoms in general, but they do require quite a bit of work and are really kind of a religious adherence to them. But sure, that can be helpful just to help to prevent so many nighttime awakenings.
I'm curious, in your practice, do you find that women who have had children tend to struggle with this a little bit more than women who haven't had children?
Well, look, there are so many risks for pelvic organ relaxation and urine leakage as a result of that. Having children is one of them. Having really big children or instrumented deliveries is another. But some of this is genetic in nature. It's just the way the tissue is based on, what you inherited. Some of this could be due to weight, so that's something to keep in mind. And some is due to external factors, whether it's caffeine intake or your fluid hydration status, all of which contribute to urine habits.
It's tricky with, these symptoms because there's so many contributing factors. And I think that that's where a lot of the confusion around menopause symptoms really comes into play, because it could be lifestyle, it could be your diet, it could be
all of the above.
Your medical, genetics, things like that. Mm-hmm. The medical history that you're bringing to the table, I think requires a lot of intentionality on the patient's part to kind of be aware of their symptoms.
Oh, for sure.
Track them.
Even things that sometimes people don't even think about. Maybe they're taking a diuretic, a medication that helps you to urinate more because it controls blood pressure. Altering the dosage of that may be the absolute answer to helping with your urinary complaints at night, but has to be done with a lot of forethought because, after all, we want to control blood pressure. So some of these nuances are real.
Okay, and so are there any foods, certain diets that can maybe help women promote good sleep, quality sleep?
This is tough because I think everybody's very individual, but surely people rely on chamomile tea for relaxation, kind of settles the gut a little bit and may be helpful. On the flip side, drinking too much before bed may cause awakening because of the need to urinate. Lavender, not that people are eating lavender, but lavender is known to be a relaxing agent. So whether it's with a small amount of an essential oil or using it in an eye mask or something, that may be helpful for some people when it comes to relaxation and sleep. I think with diet, it's almost more about what you're not taking in than what you are taking. And so caffeine, alcohol, sugar, ultra-processed foods, large meals, super spicy foods, these are all things that might have a negative impact on falling asleep or staying asleep.
These are things that, all in all, healthy lifestyle changes that can, of course, benefit people all throughout life. Just perimenopause and menopause. Right. At what point do you think women should really kind of get serious about locking in these routines?
ASAP. Look, why wait until something is bothersome? And it's never too late to start. That's something I really love to impart on my patients because, it's never worth giving up. It's never too late to start a healthful diet, a good exercise program, the stress reduction measures or sleep hygiene measures that are helpful.
Yeah, and I think, with a lot of these things too, with, major lifestyle changes, it's more about consistency than perfection as well. So it's really just about getting started, starting to implement maybe one or two healthy habits, and then it becomes that much easier, especially if it's really helping the symptoms. And I feel like if you have good sleep, then everything just becomes that much easier.
Yeah, for sure.
So we've addressed sleep issues and how menopause can affect them. And it really all comes down to, we've defined what sleep hygiene is, the different various lifestyle and diet changes that you can make to help promote restful and quality sleep. And I think we have some really nice practical takeaways that we can apply. So thank you so much for taking the time, Dr. Dweck. We really appreciate it.
Sure. Sweet dreams.